A common question that I get from women is, do I have endometriosis? Is my menstrual cycle normal? I had somebody drop a DM for me yesterday and she said, I can't tell if I have endometriosis or not. So to let you know, I'm a holistic doctor and I'm also an integrative medical practitioner. I can answer this question for you. I want to talk to you about how it correlates to traditional Chinese medicine. That is my base foundation. And it makes the absolute most sense to me with a whole picture of a woman as opposed to a very small area. So according to traditional Chinese medicine, menstrual health is a reflection of the body's balance and the smooth flow of oxygen and blood circulation. We need to circulate oxygen to push the blood through the body. It gets a lot more detailed than that, but that's all that you need to know right now. Traditional Chinese medicine differentiates between what is considered normal and what looks like a healthy menstrual cycle, and the symptoms that may indicate an imbalance or a health issue. So let's get into what looks like a normal period. What are the normal symptoms and signs of a traditional Chinese medicine view of what a woman goes through every month? What is considered normal is mild to moderate menstrual cramps. So traditional Chinese medicine recognizes that mild cramping can be normal, mild, so as it's associated with the movement of blood and oxygen. So these cramps should be tolerable and typically subside after the menstrual flow begins or within the first few days of the period. This is not a time that a woman has to call out from work or she's debilitated and can't do light movement or exercise. And I have a lot of that information in my other endometriosis videos. So please have a look at those. I will post the link at the end of the video. Next up, we want to look at what is a regular menstrual cycle. So a regular cycle can range from 26 days to 35 days. And this is considered a sign of balanced health and normal function of the reproductive system in traditional Chinese medicine. It goes a lot more detailed than this. I've had some patients that say, oh, sometimes it's 28 days, or then it may be 29, or then it may go to 27. That's okay. It's within a couple days and it still maintains that range. Next, we want to talk about the flow of the menstrual cycle. So menstrual flow is considered healthy when it's neither excessively heavy or too light. So in between that, so the normal flow should be sufficient but not overwhelming, and that usually will last about 4, sometimes up to 7 days. So if a woman has a menstrual cycle that's 2 days and it's light, and then we'll get into color next, but there's a lot of different colors that can show up, or if it's heavy and it's more than 7 days, or if a woman's changing her pad or tampon more than 4 or 5 times a day, that could be considered heavy. The other thing is, I'm going to put a side note in here, but I have a lot of videos on this, is that if you have a heavy cycle and you have menstrual clots in there, women shouldn't use tampons. But again, I have other videos on why, and I can link to that. And before we go any further, my name is Dr. Gina Rosella Terinoni. I'm a holistic doctor, and I'm also a certified integrative medical practitioner. And I help women and couples to get pregnant. I've been seeing patients privately for over almost 25 years now. And I help women from fertility challenges, endometriosis, PCOS, through perimenopause and menopause. So definitely subscribe to the channel, and you'll get tons of information about all things women, female, hormone health, everything in here. Okay, back to it. So let's talk about the color of menstrual blood and the consistency of menstrual blood. I already mentioned clots a little bit, but healthy menstrual blood should be a bright to a little bit dark red color without large clots. There may be like little stringy clots, that's okay. But if you have large clots that are like nickel size or like a quarter sized or this big, that's too big. And when we see small clots being normal, larger clots indicate blood stasis. This is a problem. This is what can cause or can show the signs of something like endometriosis. So I do go into that in a lot more detail in other videos, but I'm trying to keep it to these are the basics to look for. If you're someone who's thinking, do I have endometriosis? Is this normal? What's going on? My idea is that if you're really thinking about that and you're concerned, most likely a woman who's saying that does not have a normal cycle. But let's get to the rest of them. So next we want to talk about PMS and what that looks like. Mild premenstrual symptoms may be considered normal. Severe PMS is viewed as an indication of trouble, and that it's black and white. If this is a consistent for a woman, then definitely talk to a doctor that specializes possibly in endometriosis, but there's other causes for this as well. This could be a pre-stage of endometriosis. So good to follow up and don't just rely on something like ibuprofen or painkillers to get through it. I can share that when I was in high school, I got my cycle at like 15 or something like that. I had terrible menstrual cramps and was told by the doctor, this is just normal. This is how it is in your family. This is not true at all. So please, if you run into a doctor that says something like that, it's really important to get a second, even a third opinion. And if a woman has or thinks that she has endometriosis, seek out someone like myself that can work with you to get the proper support, because women are overlooked, especially endometriosis. Sometimes it can take up to 7 to 9 years to get a diagnosis. Then a woman's got to go through all these hoops and everything after getting a diagnosis to try to get a proper treatment. So we talked about larger blood clots. We looked at PMS and symptoms of that. Something that would be considered normal for mild PMS. It's you want to know that you've got your cycle happening, right? Because it will slow things down a little bit, more self-care, no swimming in a pool. There's a lot of things not to do while a woman has her menstrual cycle. Okay, so mild would be slight bloating. Maybe there's a little bit of tenderness on the belly, slight mood changes, not extreme, not severe tears, but maybe feeling a touch weepy. Maybe you want to drink some tea, read a book. You're more in that zone. Some minor breast tenderness that can be considered normal. And again, all of these symptoms should be manageable and they should not be debilitating. What we really want to look at is overall well-being, feeling generally healthy, well, without significant fatigue, not sleeping for a lot of hours, not having to be confined to a bed or to a chair with constant heat, not emotional distress or other severe symptoms like I'd mentioned. If you have slight symptoms, that is considered a healthy sign, a normal sign of healthy menstruation, according to traditional Chinese medicine. And one that I didn't mention, which is common, is low back pain, but very mild to moderate. You're aware of it. It's not a big deal. It's not going to ruin your day or several days. So understanding menstrual cycles according to traditional Chinese medicine, it's wonderful to have a cycle because it's like a report card. You get to see what are the telltale signs that something is imbalanced and what is a red flag. It's really important. So the first thing I would recommend is to track symptoms and signs, pain levels and discomfort, energy levels. There's so much more. I have a free journal, like an endometriosis. If you need some support with that, drop a comment below. I am happy to send that to you. But in traditional Chinese medicine, the concept is often called liver qi stagnation or liver qi depression. And this is usually the culprit with liver or menstrual health, because liver is to be responsible for the smooth flow of oxygen and blood throughout the body. And when the liver, we say like energy, but if it's flowing properly or smoothly, the menstrual cycles will be regular and the symptoms again are mild. On the other hand, and when the liver gets stagnant, which happens a lot more intensely, say in the springtime, because liver is springtime in Chinese medicine, this can lead to various menstrual symptoms, including pain and emotional intensity. Keep an eye out for that. The emphasis in traditional Chinese medicine is on balance of oxygen, blood flow, and then absence of significant mental, physical, emotional discomfort. It is crucial to take care of your liver and to understand the cycle. Comment endo, and I will send you my endometriosis inflammation elimination guide. Thank you for watching.